coming to the Pain Institute with Dr. Jasper. Started having pain about almost 6 months ago. It was beginning of August, I believe. I'm actually an active member of a fire department where I live, and we were working on an accident scene, and I ended up herniating a disc in my back, and by the time I got back to the fire hall, I couldn't even stand up to get out of the fire truck. I was taken to my local ER. They gave me a couple pain shots to try and take care of it, and some x-rays. Didn't see anything. Was told to come back in a few days to see my family doctor. So I went back, got an MRI scheduled, got the results back, find out I had a herniated disc in L4, L5. He set me up with an appointment with a surgeon. Basically that surgeon gave me options of being on pain medicine for the rest of my life, which I wasn't really interested in. Living with the pain, which obviously if I could do that I wouldn't be here. Or he wanted to cut my spine open. And at my age, I really have no interest in that. After a few days, I've been working the whole time with pain every day. Normally, like, my family doctor put me on steroids for a week, which, yeah, it helped. Took the inflammation down, obviously. Helped for a few days until I went off of them. Generally, to get up and go to work every day, I would take 2 or 3 pain pills every morning just to make it through the day. A few days after the consult with the other surgeon, actually the guy I work for is good friends with Dr. Jasper, and he told me to go see him, so I made the phone call, set up the appointment. My first appointment with Dr. Jasper, he reviewed the MRI, we went through all the scenarios, and he gave me a shot in the nerve, I believe, to try and reduce the swelling to see if it would correct the problem. Felt good for a couple days, and then the pain just came back. So after a few more visits, the whole time I'm still doing light duty work, and I have a daughter, and it's really tough. Little kids always jumping in your arms and stuff makes it very, very painful. Trying to pick them up or carry them or even put them in the truck to put them in the car seat. It's just excruciating. Normally the pain was in my lower back, and it radiated down through my left hip, and from my knee down it was just like a stabbing pain most of the time. Just standing around, my whole lower leg and foot would go numb, which obviously everybody knows how their foot feel when they fall asleep. Sitting down on a couch was very painful, very uncomfortable. Normally, to get any comfort, I would have to lay down, which, having a very active child, it's almost impossible to keep that going. My last visit with Dr. Jasper, he suggested the surgery that he does. It's a selective endoscopic discectomy. At this point, it's going to give me my life back, so I'm here today to get the surgery done, and I'm pretty excited about it. It'd be nice to be able to go home and pick my daughter up in 2 weeks without any pain. I actually got the injury by working on a car accident as a member of the volunteer fire department where I live. Obviously getting this injury was not something I expected to do that day, but as most firemen know, carrying the jaws of life around, or even putting on air packs and carrying all your gear and trying to fight fires, takes a toll on your body, and obviously it caught up to me that day.
Does this look like a patient? Does this look like a patient that just had spine surgery and finished 30 minutes ago. How do you feel?
Not bad, actually.
You have any pain?
A little bit.
Where?
A little bit in my lower back.
Lower back, that's where the incision is. That's where we put the little teeny incision. But you'll see the video. Let me see your feet here. I want you to pull your toes towards you as hard as you can. Hard, hard. Move my arms. All right, good. And push down. All right. That was your left side, correct? All right. Can you bend your knees up? How's that feel? Any pain? All right, you put them back down. Alrighty. So he's about ready to go home, about 15, 20 minutes of getting dressed and walking around and going home. And we'll see him next week in the office for a follow-up visit. We'll put that on the video. Good job. All right.
Hi, my name's Mike. I'm a patient of Dr. Gabe Jasper's. It's been 4 weeks since my select endoscopic discectomy. Yeah, that's hard to say. My pain is probably 75 to 80% gone just in 4 weeks. I feel a lot better. It's amazing to be able to wake up in the morning and not know you're going to be in pain all day long and not have to rely on pain meds to get you through the day. I plan on returning to work in about a week and a half, so that will be a telltale sign. Doctor says everything should be good to go by then. I'm kind of looking forward to getting back to work, but on the other hand, I'm a little nervous about it, to be honest, because I do hard work, but doctor says I should be fine as long as I don't do anything stupid. So hopefully in another week and a half or 2 weeks, I'll be 100% pain-free and look forward to living the rest of my life that way.
Now, what would you say to a patient who wants to undergo this procedure?
If this procedure has been recommended to you, look at all your options. Obviously, I went through my options, and this was pretty much where I ended up. And I feel like it was a very good decision on my part. And the pain is almost gone, and that in itself is miraculous. And when they tell you not to do anything for 6 weeks or 4 weeks afterwards, make sure you listen, because the pain will not go away if it doesn't.
Yeah, you feel great, and you want to start your life again, but you have to wait those couple weeks after.
You need to make sure you wait. You feel great, like you want to do something because the pain's going away, and you just feel like you want to get up and do stuff, but don't, because it's not worth it.
All right. Well, thanks, Mike.
Yeah, thank you.